Thank you very much. Good afternoon, everybody. My name is Duncan Wood. I'm the director of the Mexico Institute here at the Woodrow Wilson Center. It's great to have you with us again. I'm delighted to see so much interest in this issue. Much of our programming, obviously, in recent months is focused on questions of public health and the pandemic. It's very important for us to continue our work, obviously, in this area. But we wanted to give a special focus to the perspective from the border. Many of you know, it's one of our great strengths at the Wilson Center. The Deputy Director of the Mexico Institute, Chris Wilson, who will be running the show today, he is really one of the thought leaders in Washington, the United States, on the issues pertaining to the border. And we wanted to give a space so that we could do a reflection on the pandemic of H1N1 and the lessons learned from that, but really to focus on how things transpired at the border. And I do expect that we will be able to have a similar event in a few months' time where we can reflect on how things went down at the border during the coronavirus COVID-19 pandemic, and we'll be able to draw lessons from that. I do want to say that, back in when H1N1 hit, it was at the time, I think many of us who were outside of the direct policy sphere were unaware of the intense cooperation on a bilateral level that was going on between the United States and Mexico. It was only months, or even in my case, I think it was more than a year later, that I really began to hear the stories of the incredible cooperation that took place on both sides of the border or across the border. And that ultimately this came to be held up as one of the high points of bilateral cooperation. And many important things came out of that experience. Andrew Rudman, who's here with us today, and I have recently written a paper called Pandemics and Beyond about public health cooperation, drawing on the lessons from H1N1. But I think that those lessons at the federal level, between the federal governments, are met in terms of importance by the experience at the local level at the border. And that's part of the conversation that we're going to have today with you. So thank you very much for joining us. It is, as I said, it's an issue that we will continue to follow in our programming. And I'm deeply indebted to the leadership shown by Chris Wilson in this regard. But I'd also like to thank our other participants for being here. A special shout out to Ambassador Arturo Sarucan, who of course is a board member of ours and a global fellow. Thanks very much for being here. I'm looking forward to the conversation a great deal. I'm going to stay on this call and reserve the right to jump in if I feel the urge to say something very, very important. But for now, I'm going to pass the microphone over to you, Chris. Thanks, and take it away.
Thanks so much, Duncan. Really appreciate that. And your work on that paper with Andrew, which I think is definitely going to be a great part of this conversation. Public health issues, and especially issues regarding the spread of contagious diseases across the border, are an area in which cooperation, information sharing are in the clear interest of both the United States and Mexico. I mean, the U.S. and Mexican sides of the border are so connected. We have, billions of dollars of trade moving across the border every day. We have, millions of border crossings happening throughout each year. There's just so much back and forth that the border region, whether on the U.S. side or the Mexican side, it's really a single region. And that's absolutely the case in epidemiologic terms. I mean, it's a single epidemiological region. What happens on one side of the border can't just stay on one side of the border because of that dynamic interaction. And so that makes it, just an obvious place in which we need to have cooperation and information sharing. We've seen that with H1N1. We see that today with COVID-19. The pandemic today has and continues to have a huge impact on U.S. Mexico border communities, on border management, and on U.S. Mexico relations. Many communities are beginning to ease up on stay-at-home orders, but of course the partial restrictions, the restriction on non-essential travel across the border remains in effect to this day. So today we're going to talk about cross-border collaboration in the face of pandemics, and we're going to do so by looking back on the case of H1N1. That was obviously a very different case, and we can get into at some point in this conversation of some of the differences between the two. But we believe that nonetheless, there are some very important examples and lessons that can be taken from H1N1 and from the cooperation that existed during that period, from some of the institutions that were built before that period that were utilized during the H1N1 pandemic. But it very much is a lesson and a case study that's worth reviewing. Duncan mentioned one of the two papers, but we're very happy to have two relatively new papers on this set of topics that we're going to be discussing today. The first one is by Andrew Rudman, who joins us on the call today, along with Duncan Wood. Andrew's at Monarch Global Strategies, previously worked at the Department of Commerce and worked on health policy issues. He'll talk about his paper, Pandemics and Beyond, the potential for U.S. Mexico cooperation in public health. And then the second paper was written by Eric Lee, the director of the North American Research Partnership. It's called Cross-Border Collaboration on Public Health, the 2009 U.S. Mexico Response to H1N1. That paper just went up and is live on our website, so I invite you to download it, share it. There's a lot of really good stuff in there. The paper marks the beginning of a process to update a report that actually Eric and I worked on back in 2013 together, the State of the Border report. In this case, that report had chapters on several different border issues. It's sort of an attempt to have a more integral view of the border from Washington and from Mexico City that doesn't just focus on security, but focuses on issues like quality of life, like sustainability, economic competitiveness. And so we're doing that again this year in 2020. And we'll have chapters on health, on water, on security, on the economy of the border region. And those sections will be released individually throughout 2020, and then as a complete report at the end of the year. This is the first one of those to be released. So Eric's piece is largely derived from a series of interviews with U.S. and Mexican policymakers that worked on H1N1. And we're lucky enough to have three of those people with us today to talk about their experiences. So I want to introduce and welcome Ambassador Arturo Sarucan, former Mexican ambassador to the United States, now a consultant, as well as a Mexico Institute fellow and a Mexico Institute advisory board member. Thanks so much for being here with us today, Ambassador. Also, Ambassador Leslie Bassett, thank you for joining us. She's a former acting ambassador at the U.S. Embassy in Mexico, I believe also former U.S. ambassador to Paraguay, and is currently in the border region in San Diego. She's a lecturer at the University of San Diego these days as well. And then last, but certainly not least, Dr. R.J. Dutton. He's a public health consultant these days. He's the former director of the Border Health Office for the Texas Department of State Health Services. He's also worked on health issues in Washington, D.C., and also with the CDC in Atlanta. So thanks so much to all of you for joining us today. I'm going to now pass things over. Andrew Rudman, of course, I already mentioned you and introduced you, but thank you for joining it today as well. I'm going to now turn it over to Eric Lee to talk a little bit about some of the main conclusions from the paper and what he did with it before we then turn to our officials who had some experience during the pandemic to reflect upon, and then back to Andrew to shift gears into the other papers. So Eric, please take it away. Thanks.
Well, thanks very much, Duncan and Chris, for the opportunity to work with the Mexico Institute yet again, and to be part of this great series on bilateral cooperation on pandemics, which includes your recent conversation with U.S. Ambassador to Mexico, Christopher Landau, and a fantastic paper on pandemic cooperation by Duncan Wood and Andrew Rudman. Thanks very much to the panelists who are with us today, as well as two additional folks who I interviewed, very important people. Robert Guerrero, director of the Arizona State Department of Health Services Border Health Office, and Dr. Gerardo Alvarez, director of Disease Control and Prevention for the state of Sonora's Health Ministry. And finally, I'm delighted to be able to contribute to the State of the Border 2020 initiative. As Chris mentioned, the 2013 edition that Chris and I co-edited was well received, enthusiastically received, and I think in part because many people were surprised to realize that the region could be analyzed not only through the lens of border security, as Chris said, but also through an exploration of the economy, the environment, as well as quality of life. That was news to a lot of people, and we're going to continue with that multi-sectoral analysis this year. So there are a number of ways to tell this story about quality of life in the U.S.-Mexico border region. In 2013, Francisco Lara looked at, he wrote the chapter for us that year, and his analysis focused on key quality of life dimensions and indicators. It's a great analysis, and I think still recommended reading. We've taken a different approach this time, focusing just on health, specifically U.S.-Mexico cross-border health collaboration. And the other main difference is that we are stepping back a bit as analysts and letting participants and practitioners provide us with a kind of oral history of the 2009 pandemic. Why the focus on health? When you discuss the U.S. Mexico border region, particularly from the U.S. perspective, we are talking about one of the poorest regions of the United States. There's really no way to sugarcoat it. This is an area, after all, that has its own development bank, the North American Development Bank. Chronic diseases such as diabetes and obesity and ongoing challenges with access to healthcare are especially concerning. And as we are seeing with COVID-19 this year, it is precisely these types of underlying conditions that become even more worrisome for health practitioners and the public in a pandemic. Just to give you a very basic outline of the story of the 2009 H1N1 pandemic and the bilateral collaboration that happened in response. This did not catch the U.S., Mexico, and Canada unprepared. That's important to note. Since the early 2000s, and particularly under the Security and Prosperity Partnership, which was later superseded by the North American Leadership Summit, there was an intense focus on the possibility of pandemics. Indeed, the SARS epidemic of 2003 really was a wake-up call for the three governments, and a lot of planning went into pandemic response. The first edition of the North American Plan for Pandemic and Animal Influenza, this was a trilateral document. It was first published in 2007, 2 years before the pandemic, and then republished in 2012 with lessons learned from the pandemic. Just some basic data on the pandemic itself. The earliest known human case of infection was in the state of Veracruz in Mexico in March 2009. Now, this was a surprise for the three governments because they had been expecting to have to respond to a pandemic a virus coming from Asia. So that was a surprise. The virus, this was a very rapidly moving virus. The virus was first detected in the United States with a case in California on April 21st, and then another case was detected in Texas a couple of days later. The World Health Organization formally declared a pandemic on June 11th, and a vaccine was developed. An effective vaccine was developed over the course of the year and made broadly available in December of 2009. Which is interesting. It's as an influenza virus, it is, there's been a lot more work on developing vaccines for influenza viruses. Maybe Dr. Dutton can dive into the technical details there. The CDC estimated that the disease brought between 43 and 89 million cases just in the United States that year. And ultimately, 12,000, the estimate is that 12,469 people died as a result of H1N1. We're now over 100,000 deaths in the United States, so that gives you an idea of the difference in intensity and scale. And finally, as an interesting contrast to 2020, the U.S. and Mexican federal governments never deemed it necessary to close the U.S. border, even partially, and that was an interesting aspect of 2009, and we can go into that a little bit more later on in the event. It was an interesting policy decision taken by the two governments that I think bears some discussion. So I think that one of the important takeaways here is that this was a pandemic that was less deadly, but still immensely frightening from a public health standpoint, as well as the standpoint of citizens in the US, Mexico, and beyond. And as I said, hopefully Dr. Dutton can add some technical context to these numbers. And so, as we mentioned, the chapter is comprised of 5 interviews. They are really just fantastic. They were a lot of fun to do, very, very interesting. And so what stands out from these interviews? I think, first of all, these are just outstanding firsthand accounts with quite a bit of drama and a lot of technical detail on cross-border health collaboration. It is really quite a a community, quite an interesting ecosystem of organizations that, that work on this at the multilateral, bilateral, federal, state, and local levels. Ambassadors Bassett and Sarukan give what I think are really gripping accounts of the spring of 2009, where you have a number of major events coming together all at once, including the initial outbreak in March, spring break in Mexico, U.S. spring break to Mexico, Semana Santa, the designation of H1 as a public health concern by the World Health Organization, and a state visit by President Obama, who recently came into office in 2009, to Mexico City in April of that year, just as the outbreak was beginning to gather steam in Mexico. So at the state level, Dr. Dutton in Texas, Robert Guerrero in Arizona, and Dr. Gerardo Alvarez in Sonora tell what I think is a really longer scale and more historical account of cross-border collaboration on public health issues. The Arizona-Mexico Commission, Comisión Sonora Arizona, for example, go back over 60 years and have a committee or a work table on health issues. And Robert Guerrero and Dr. Alvarez are very active, obviously, on that committee. I think what stood out for me from the state officials' account was the complexities of working with very powerful multilateral, bilateral, federal agencies in such a complex region, and the creativity that's required to work in the middle of this alphabet soup of organizations and these very, very strong federal agencies that have so much budget and so much power over how our border, our shared border is managed. In terms of lessons learned, I have at least a page or so in the paper, which is now up on the Mexico Institute site, but I'll leave you with just 2 or 3 of them. And one is that the border functioned neither as a wall nor a membrane during the 2009 pandemic. Pandemics move with extreme speed and really stress a whole range of human systems, including government. But that only underscores the need for really diligent, careful planning in the areas that can be foreseen. For now, I'll leave it at that, and I really will move out of the way so that we can hear perspectives from the rest of the panel. Thank you.
Thanks very much, Eric. I just want to remind everyone in our audience that you can send in questions. We're going to hear from our panelists, but then we'll get to an audience Q&A. So if you'd like to send in a question, you can send it in via email to mexico@wilsoncenter.org. That's mexico@wilsoncenter.org, or by tagging @Mexico Institute on Twitter and sending in your question that way. So next, I'd like to turn to our panelists that worked on H1N1 in an official capacity to share a bit about the experience they had and any of the lessons that they learned during the pandemic. And if I could first turn to you, Ambassador Bassett, to start things out. Go ahead.
Terrific. Well, greetings from San Diego. And I do want to thank Eric and Chris for including me in the conversation, and also take this opportunity to thank the Mexico Institute for many years of appreciated contribution to an enriched U.S. Mexico dialogue on a whole range of issues, a dialogue that allows all the stakeholders to come together and speak in a safe place, but also a dialogue that focuses on sort of realistic recommendations. And I think the paper that Andrew Rudman and Duncan Wood collaborated on is a terrific example of this work. So thank you for that. I also want to thank you for the opportunity to reconnect with some esteemed colleagues. I, of course, remember Andrew Rudman and Ambassador Sarukan very fondly from our time working on Mexico issues together, and I do look forward to hearing from Dr. Dutton as well. I think the border perspective and the state perspective is fascinating, especially as I am now a resident of the border myself. So reflecting back on H1N1 in 2009, I had sort of 3 overwhelming impressions I thought might be useful to share. And the first is that, Eric talked about all that we now know about H1N1, but in the first few days of understanding that we were on the brink of a new experience, a pandemic response, what I remember primarily was confusion and uncertainty. There was enough information for medical professionals to come forward and say, here comes a big problem and we should be taking drastic measures, but not enough to be able to share with the community information that they all wanted to know. What's the death rate? How do you transmit it? All the questions that, of course, we're asking today about COVID. And that uncertainty and is sort of compounded by the fact that medical professionals will tell you no two pandemics are the same. They will not extrapolate from previous experience, and they will not speculate on timelines or other measures that need to be taken until they have scientific information and data. So what they're asking policymakers to do is to give them the time and space to collect that data and assess it while protecting the population as much as possible. And that leads me to my second point. Beyond the confusion and uncertainty, there was the need for political courage to take tremendously costly and difficult decisions without a lot of information to work off of. And I am continually impressed by the determination, commitment, and integrity of the government of Mexico in taking those very hard decisions, essentially overnight, to close schools, close businesses, all the things that we're now experiencing with all the concomitant costs in order to do, the number one necessity, protect people, not just in Mexico, but really because of Mexico's quick actions. It enabled the global response that essentially protected a much larger population of vulnerable people. And that leads me to my final observation, which was the record of collaboration, cooperation, and open communication that persisted throughout the experience. Mexico was immediately transparent to the World Health Organization, the Pan American Health Organization, and all of the alphabet soup of organizations that had some stake in either the response or the investigation of the pandemic or the management and messaging to communities about the pandemic. They were also extraordinarily generous in inviting experts in to work with their own teams side by side in laboratories, in medical centers, in veterinary centers. We had people visiting swine farms to try to find, pig zero. It was a tremendously intense collaboration. And because of Mexico's openness, I think they both facilitated a more rapid investigation and assessment of the pandemic, of course, facilitated better treatment options and ultimately the extraordinarily rapid development of a vaccine. And this is my opportunity to offer a long overdue tribute to my counterpart in Mexico City at the time, the Undersecretary for North American Affairs, Dr. Carlos Rico, who was an extraordinary human being and an extraordinary diplomat. And in this partnership, as in so many different ways during our time in Mexico together, really contributed to positive outcomes for both of our nations and for the entire hemisphere. And this is just one example of that. And with that, I will cede the microphone. Thank you so much.
Thanks so much, Ambassador. I think that that's an incredibly important account, and it really, it makes me ask the question, how is it or why was it, what was in place that pushed Mexico or allowed Mexico to be so sort of open and transparent and quick moving on this topic? And so maybe Ambassador Sarukhan can enlighten us a bit on that, but he could start hopefully with some of his experience. He was in Washington at the time, and the takeaways that this whole episode left you with. Ambassador, please take it away.
Thank you, Chris, and good afternoon to all. It's a pleasure to join you today and to be again with the Mexico Institute, the Wilson Center, accompanied by so many good friends and colleagues, and in particular with Leslie, who was holding the fort while the U.S. ambassador was going through the hoops and hurdles of getting to Mexico. So she was suddenly not only in charge of the day-to-day relationship, but she found herself suddenly in the middle of a huge crisis that caught us all with our hands in the door, literally as President Obama was doing his state visit to Mexico. Several issues that I think are important to underscore. Number one is that, and you've already heard some of this, you can't cook up this type of collaboration if there isn't institution building and trust that has been taking place over a significant period of time in this bilateral relationship. This phrase that many of you have heard about the institutionalization of the relationship, well, the ability of Mexico and the United States to effectively, despite the huge challenge and the uncertainty and the moving terrain, to constructively address together, hand in hand, the H1N1 pandemic was the result of taking advantage of what we had been building together as governments. I served the last 2 years of the Bush administration, the first full 4 years of the Obama administration, and the heavy lifting had started before we even reached 2009. And it tells you a lot about how important this muscle tone, this muscle memory that the relationship has, where governments should learn that you don't discard stuff and mechanisms and protocols simply because there's a new government in town. There's a sense of building upon, you tweak. Obviously, each government has its own emphasis and its own preferences, and we all go about reinventing and tweaking and fine-tuning. But you build upon these protocols of collaboration in what is the most complex bilateral relationship in the face of the earth. The second issue is transparency. Many of you have already spoken about this, but the ability of both countries, both governments, to very quickly come together, provide each other a readout of what we were seeing, what was going on. This was obviously most apparent when President Obama goes down to Mexico City, and at the state dinner at the National Anthropology Museum in Mexico City, he gets a guided tour by the then director of the National Anthropology Museum, Felipe Solis, who happens to die a few days later on April the 23rd because of previous complications. But the effort to ensure that, because he had been with President Obama, to share medical records, to make sure that the White House knew what was going on, what had happened with Felipe Solis. This is just one example of the transparency with which both governments engage with one another, the levels of mutual trust and confidence building in the relationship, and the ability of both governments to very transparently and publicly talk to the public opinions, to the media, to international multilateral organizations, and explain what we knew as we knew it and as things evolved. Communication, a very important piece in all of this. When we were starting to understand what was going on, and then throughout the rest of the crises, the collaboration between CDC and its Mexican counterparts, exchanging information, communicating on a permanent basis with a density that is troubling not to see these days occurring in the U.S. Mexico bilateral relationship. And finally, humor, good humor, a good sense of humor. I right after actually in the midst of the pandemic still, but after President Obama's trip to Mexico, we were at the White House, the annual White House Correspondents dinner. And it was President Obama's first White House Correspondents dinner. For those of you who've been there, you know that this is a typical roast. And so the president is talking, and you know, he talks about his relationship with Hillary Clinton and the fact that they had been obviously rivals in the Democratic primary. And he says, you know, there are some people who still question whether Hillary and I, despite her being on my team as Secretary of State, get along after the campaign. And he says, I like her so much that as soon as I got back from Mexico, I told her, you've got to go back and hug and kiss everyone. And when we stand up at the end of the dinner and we walk out, he looks at me and suddenly says, oh boy, I hope you don't mind the joke I cracked. And I said, Mr. President, I've got a good, very sense of humor as you do. And so these personal, but also bureaucratic and institutional dynamics that played such an important role in creating a sense of co-stakeholdership, which is painfully missing today, where Mexico, on the one hand, is a constant threat to the national security of the United States, but at the same time, we're badgered because essential services and industries are not aligned, where Mexican migrants are essential, but they still live in the shadows because they're serving the ag business in the United States. So I think that what you saw in 2009 and the effectiveness of what you saw in 2009 was something that has been evolving and has been built into the U.S. Mexico relationship. It's unsexy many of the times. No big announcements and no photo ops. It's the hard day-to-day work between different institutions, agencies, bureaucracies on either side of the border that build this density in the U.S.-Mexico relationship, which, by the way, no one notices it. No one notices it until you've got a crisis or there's a problem, and then those mechanisms and that architecture and that machinery starts moving and delivering the results. So I'll stop here, Chris, and allow the other panelists to address the issue, and then we can get back into some of the nitty-gritty of this, I'm sure, in the Q&A.
Thanks very much, Ambassador. This is some great stories. It's fun to reflect back, but I think it does really show what you're sort of talking about there. I mean, it's about having the protocols and the institutions, but institutions aren't just about the sort of the rules or what it says, you should contact this person. It's about creating a forum in which that trust develops. And that was something, you were with us when the Mexico Institute with the U.S. Mexico Foundation recently convened all of the former, or many of the former ambassadors from the U.S. to Mexico and Mexico to the U.S. And that was something that I was just really struck with in that set of conversations, was the importance of trust building, of confidence building, of relationship building. And that's kind of, that's the capital that you walk into a crisis with. And so I think you do a really good job of highlighting the importance of that. So thanks very much for that. I want to now turn to Dr. Dutton. You were in the border region dealing with the pandemic. What can you tell us about your experience dealing with it and the lessons you learned from that period?
Thank you very much. It's a pleasure to join everybody. First of all, public health and the border aren't often at the forefront of major, bilateral discussions. We typically follow economic development and security, but so it is a real pleasure to focus on public health and the U.S. and Mexico. One thing I wanted to say as a preamble is that infectious diseases along the U.S.-Mexico border have been a priority really since the 1930s, when I first saw documentation by Congressman Thomason of Texas and El Paso introduced a bill that didn't get passed to form a U.S.-Mexico border office to address infectious diseases such as cholera, dengue, typhoid fever, tuberculosis. Some of these are still persist to the present day. The delegation out of New Mexico, Tom Udall's office, just introduced a bill called the Border Health Security Act, using the term security and health together in a novel way, to continue to address issues such as infectious diseases along the border. So you've got a span of almost 100 years of continued interest in infectious disease on the U.S.-Mexico border. And that's another story in itself, I suppose. But intermittently, you might say, there's been pandemics. The 1918 pandemic had a big impact on the border. The 2009 was, of course, amazing that it came out of Mexico. And I wanted to say in relation to that everybody's correct. I guess the obvious observation that you don't prepare for a pandemic in the middle of a pandemic. And whatever institutional building and relationship building you've done comes to the forefront. And that's a very important issue. The one thing I wanted to say as a lesson learned that was very striking to me was Mexico's response. Dr. Jose Cordova Villalobos, the Secretary of Health, the Secretaría de Salud, was amazing. And I know that the president decreed the authority to the Ministry of Health in Mexico, and there was a lot of transparency and openness. that led to Canadians and Americans helping with laboratory capacity building and any number of things that was quite impressive. And I think it's a benefit to the entire world how Mexico operated during the response to the H1N1 2009 pandemic. The other thing I guess I wanted to mention is that it's worth noting for me as someone who's worked for over 20 years on the U.S. Mexico border that yes, it is one epidemiological region, consists of about 14 million people from Baja California to Tamaulipas to Texas and back. And that region is defined by special issues related to health disparities. So for example, in H1N1, we noticed that, of course, as everybody else has observed, that a bigger impact occurred in younger people than older people. And on the border in Texas, 85% Hispanic, high levels of obesity and diabetes, we saw a real threat to particularly pregnant women who had high levels of obesity. And there was a number of deaths associated with that. So in some ways, that does relate to the COVID issue and concerns about access to healthcare and social determinants of health in the population that I think are something that people can reflect back on and hopefully learn from. I guess the other thing I wanted to say about institutions is that, frankly, the one important thing to mention about institutions after 9/11 and the anthrax scare, there was a big investment in the United States in preparedness, and that was important, I think, for all the federal government as well as local and regional and state governments to be prepared for H1N1. Very important. Was led up. They weren't necessarily expecting this, but the strategic national stockpile, the ability to respond to development of vaccine, all this was in place. The bilateral aspects of this, another question, but they point to the fact that it's very important for us to emphasize these agreements between U.S. and Mexico on public health, and hopefully implement them and sustain them over time, because sometimes they're fragile, and unfortunately, when governments change, you have to start over in a sense. At the local level in the U.S. Mexico border region, there's actually quite phenomenal interrelationships at the sister city level as well as the state-to-state level. And these are trusted relationships we have with the secretaries of health on the other side. But ultimately, if you want an epidemiologic surveillance system, you do need to engage the federal governments, particularly in Mexico, where there's certainly a more central control of health, public health implementation. So thank you very much. I really appreciate being here with you guys.
Thanks very much for that. I mean, I think you raised the point that should be obvious at this point, which is that we're not just talking about a federal to federal relationship. We're talking about a multi-level relationship, and I think that's an important thing for us to bring into the conversation as we start sort of thinking more about how this, those lessons and how they apply to today. Of course, the relationship between the AMLO administration and the Trump administration is a piece of the story, but it's not the only piece of the story. It's also a story of how San Diego is connected to Tijuana these days, how Texas has relationships with its state counterparts across the border. I mean, the complexity of the relationship remains, and we may have seen divergent trends in some ways in terms of how we've developed and continued to have preparedness, relationship building, institutionalization over the years. So I'd like to, at some point sort of bring the conversation to think a bit about that. I want to now turn though to Andrew Rudman. If you could please tell us a little bit about the work that you and Duncan did, and then in particular, some of the things that you found most relevant looking back at H1N1 as we're thinking about the future of public health cooperation between the United States and Mexico. Andrew, the floor is yours. Thanks.
Great. Thank you, Chris. Really, and to the Mexico Institute, this is a great topic. Really happy to have been able to participate, and great to see some old friends and colleagues whose presentations so far have been great. And of course, I should particularly thank my co-author, Duncan Wood, who I'm sure will keep me honest if I go off the rails here as I try to describe what we did in our paper. I think as has already been discussed to some extent, Health collaboration is maybe one of the underemphasized areas in the bilateral relationship, and one where there really is a great deal of unrealized opportunity. And our paper, which was prompted by COVID-19, but in truth was something we'd been talking about in the Mexico Institute, had been looking at for some time. But the paper tries to address some of that unmet or undefined potential, if you will. The paper has two parts. We first talk about the development of the institutional mechanism, the PAPI, the North American Plan for Avian and Pandemic Influenza. And then we look at some potential opportunities going forward for health cooperation beyond pandemics. And while we're obviously all thinking about COVID-19 right now and thinking about that, I think it makes sense to also think looking forward about what else can be done, what else can happen in this topic. So we've already talked some about the North American plan, so I'll just share a couple thoughts or observations, probably in some cases echoing what's been said. And there's much more detail in the paper. But the PAPI was developed to promote a comprehensive approach to responding to avian and pandemic influenza. And it was originally conceived thinking of a pandemic coming from outside the region, similar to COVID-19, but obviously not taking into account what ultimately happened in 2009 with H1N1, which developed first in Mexico. The 2012 update does take into account that there could be pandemics either developing in our region or coming from outside the region. And it also expanded the focus to avian and non-avian influenza. And it provides, I think, an important policy framework to enhance trilateral cooperation, to detect, monitor, and control outbreaks, to facilitate communication, to prevent or slow the entry of novel virus into North America, to mitigate and minimize illness and death, and to sustain infrastructure. So all things that we obviously need to have happen. It matters. I think the PAPI and the whole effort to create this mechanism really, I think, has three important points. First of all, it's a recognition that an outbreak in one North American country is or will soon be an outbreak in all the countries. That you can't go this alone. You can't wall yourself off from a pandemic, and at the same token, you can't manage it by yourself either. You're going to get it as a region, and you have to manage it as a region. And I think the third thing, Ambassador Sarukhan mentioned this happened in what maybe now is the golden age of North American institution building, North American cooperation, where the three countries recognize the need to have institutions that can go beyond the politics and can sustain such an important relationship. So after each crisis, the leaders or the countries have come back together and reviewed NAPAPI and looked for best practices and ways to make changes. And we certainly hope that happens again when this pandemic subsides. It already provides guidelines and addresses, or could, with some additions, address a number of issues that we've seen arise during this pandemic, such as the stockpiling of medical countermeasures, maybe a development of a clearinghouse mechanism that would help identify where potential surpluses exist so they could be sent to places that are in need. Certainly a coordinated manufacturing response within North America could be extremely important for addressing supply chain issues. And I think a corollary to that would perhaps be discussion of what is an appropriate definition of essential manufacturing or essential industries to avoid some of the supply chain challenges that we've seen in the U.S. and Mexico in this pandemic due to those different definitions of what exactly does essential mean. And when there's a vaccine, and I'm sure at some point there will be a vaccine, collaborating on regulatory responses, that is regulatory approvals and manufacturing approvals, will be key to making sure that we can implement an effective and quick mass vaccination campaign. So turning maybe a little bit to beyond the pandemics part of the paper, what else can be done? And we look at a number of areas. for collaboration and cooperation in health policy and healthcare delivery. And I'll just mention a couple of those today. It's important to note that the collaboration can be government to government, it can be public-private partnerships, or it could be a wholly private sector-driven initiative. Regulatory cooperation, which I mentioned a moment ago, is an obvious one. And this could really enhance the efficiency and efficacy of both regulators, both FDA and COFEPRIS. And it really can be done in a way that doesn't in any way diminish their independence or undermine their objectives of protecting the health and safety of their own citizens. I think, as we talk about in the paper, that could take place with respect to inspections of foreign manufacturing facilities, and it could also work in relation to the actual approval of drugs or devices or diagnostics. Another area where I think there's huge potential is medical tourism. It's something that we've looked at Monarch Global Strategies on a number of occasions. We already know that lots of Americans, particularly, but not only in the border area, cross the border and get medical care in Mexico on an individual basis. They often find lower prices and a much more personalized care delivery than we have in the States. And that could happen on an institutional basis as well, with firms developing relationships across the border and then giving employees the opportunity to travel across the border to Mexico for surgery or treatment, which would likely occur at a lower cost, maybe a substantially lower cost, and with I think a much more personalized form of care. And then the savings from that could be shared with between the employer and the employee in some fashion. Even though our healthcare systems are different, there are also, I think, opportunities for systems and institutions to collaborate across the border, to look at perhaps pilot projects in a number of areas. Some might include value-based healthcare pilot projects, bidirectional telemedicine opportunities, and best practice sharing for remote treatment for e-health type work. And in the States, that, for example, could be a case of a small rural hospital having a video link to a bigger institution that provides guidance and training, help with diagnostics, and sometimes even instructions on how to complete a procedure in an emergent situation. And that certainly has application to Mexico. In that same vein, I think there's also great opportunity for collaboration between U.S. and Mexican universities and nursing schools to address the nursing challenges and shortages on both sides of the border. If you think about potentially joint certification or joint licensing programs, that could be extremely valuable. And the one I haven't mentioned yet, probably the most obvious one, is manufacturing. Lots of manufacturing clearly across the border between the two countries in many sectors. There are some interesting challenges with respect to medical devices, though there's a lot of production in Mexico of devices already. It's the 7th largest exporter in the world, but there are some challenges, I think, that could frankly improve Mexico's ability to move up the value chain the way it did in automotive and aerospace industries. Our paper concludes with some recommendations, as Eric's did as well. And just quickly, some of them, we recommend employing the full extent of what's covered in the PAPI now, and then conducting kind of a lessons learned, best practice exercise to see how it should be adapted for the future. We propose clearer coordination among the regulatory agencies for pharmaceuticals, devices, and diagnostics to eliminate red tape. Integrating manufacturing where possible in pharma and devices to lower production costs, and cross-border collaboration among governments, academic institutions, and the private sector to address human capital needs related to public health. So again, I think there are lots of opportunities for collaboration going forward between our countries in the health sector. And if there's any silver lining to COVID-19, hopefully it does give this a little bit of a push so that both countries, both at the federal, state, local levels, the private sector, that everybody is better prepared to respond to a future pandemic. So I'll stop there.
Thanks so much, Andrew. That's great. So I want to sort of continue the conversation for just a minute here among the panelists, but I want to remind everyone that you can send in your questions to mexico@wilsoncenter.org or on Twitter to @MexicoInstitute. I've already got a few coming in, but we've got a couple hundred people on, so please send in your questions and we'll do our best to take them. Maybe there's several things that Andrew brought up that make me want to have some conversations. I want to maybe ask Ambassador Sardo-Khan in a second about supply chains and the way that may be a missing piece of cooperation previously. But before that, could I just turn back to Dr. Dutton? Can you just sort of talk us through, as you see it, the difference between H1N1 and COVID in terms of, the challenge itself, in terms of the pandemic and the way, in one case, we decided we didn't need to have the border closed. In another case, we've decided for these partial restrictions on movement across the border. Why is it that we see those differences? And what other differences or similarities do you see that you think are relevant for understanding of what's happening today in this context?
Well, I guess just a couple of comments. I'm not sure I'm completely have the best perspective on this, but there's no question that when COVID hit, I started looking back at H1N1 and was a little bit amazed at how, when Mexico shut its schools down and social distancing and all these things that were put into place that were pretty dramatic, were starting, to be looked at here and on COVID. And we didn't do that with H1N1. There was a few things we closed, but we certainly didn't close down arenas and sporting events and schools and all that. Well, the fact of the matter is this coronavirus is different. It's more contagious. It's got a bigger impact on vulnerable people who are old. And so, 10 times to, 50 times more serious. So it was like every pandemic is different. It didn't, it was flying around the world just like H1N1, but didn't quite have the same impact. When it comes to bilateral issues for us, the closing of the border, I always remember after 9/11, they said they would shut down all the ports of entry, but they really didn't shut down the border. They sort of suggested that it could. It slowed down a little bit. So it's pretty dramatic that's actually was a part of this response. I don't know if I'm really answering the question, but when you get in the middle of a pandemic and emergency response, everybody sort of goes to their battle stations. Mexico's going to theirs. One of the more interesting things I saw at the beginning of the COVID response was Mexico expressing concerns to us about crossing. In some places, quite dramatically, even protesting, because we were the threat. And so kind of nice to see the tables turn for once. We're always pointing our fingers at them for, Zika coming up to the border, but this time they were a little concerned about us sending COVID down. But anyway, big differences between the two pandemics, but the emergency response planning and machinery that we have in place was, implemented just like it was for H1N1. The incident command system, which is a very important development since 9/11 in the United States.
Yeah, so that's really helpful. You point out some of the things that were built up over the years that have been deployed in this current case. To me, one of the areas that it seems, and Andrew brought this up, the topic that maybe wasn't as considered it, but I'm really interested to hear the perspective of, this is going to be a question for Ambassador Sardo-Khan, is, what about supply chains and sort of readiness to manage not only the public health and just the health fallout and impact of a pandemic, but this time around, it sure seems like this economic impact is just massive as well. And we're so interconnected in terms of manufacturing across the border. Supply chains are sort of exposed in a way today that I feel like they haven't been in ages. We're all asking questions about how things get to our grocery store shelves and whether they show up there. What preparation, should we be doing to be better prepared for, the next emergency, whether it's a pandemic, frankly, or maybe something that's different, a natural disaster or something like that, but sort of supply chain preparedness. What are you thinking about that topic, and what have you seen play out, Ambassador, during this COVID crisis?
Well, as has been said, that no two pandemics are alike, and there isn't a one-size-fits-all approach, because each pandemic and the epidemiological patterns of the pandemics or of each pandemic is very different. And so it's hard to sort of extrapolate, okay, here's the template for the next one. What you do with previous experiences, because you don't want to replicate the paradigm of World War II generals fighting World War I as they planned for hostilities, is again, the process and the lessons learned. And one of the things that I hope the three countries, because the three countries are equally guilty, the one lesson learned from this pandemic is that particularly in Washington, they now understand what we've been banging away with when we've been talking about protecting supply chain, joint supply chains and production platforms in North America. The fact that none of the three governments at the outset of the pandemic, everyone rushed to the border issue because you've got a nativist in the White House who's obsessed about the border, and obviously, there was a bit of jujitsu both in Ottawa and Mexico City saying, okay, let's do it together. So it doesn't seem to be a unilateral imposition from the US, and because of some of the societal concerns in Mexico, because of the patterns of the pandemics, it made sense to sort of minimize non-essential crossings. But none of the governments thought of, because of how profound this was going to be for our economies, of trying to take into account the specific patterns, the public health and health patterns in the three countries, trying to synchronize and harmonize what is and what isn't an essential industry in each one of the three countries, so that we could minimize disruption of supply chains. And it's not only relevant for this is I think more than cars and airplanes, aerospace or auto sectors in the US, which is where the US private sector really got antsy because of the lack of symmetry in the supply chains between Mexico and the United States. The one that I think is even more important, and where I'm afraid that we might see some jingoism and chest thumping and nationalism going forward, is how do we protect the supply chains of our medical devices industries? Again, because of the role that Mexico plays in number one exporter of medical devices to the United States. How do you prevent from some of the deglobalization and sort of nearshoring and nationalistic posturing as to bringing supply chains back home? How do you prevent further dislocations, particularly in sort of the health and medical device industries, from damaging our security and our human resilience? And so I think this is one lesson that needs to be processed and learned. I think this isn't a forum to talk about supply chains, but I do hope that one of the lessons learned from this is how important it is for the ability of North America as a region to more or less mitigate the dislocating impacts of COVID by understanding how important our joint supply chains are, and by understanding that that is one of the cornerstones of our future prosperity and security, but also about the relationship that the United States, I think, will be having, regardless of whether there's a Democratic or Republican administration come January of next year, with China. So these are some of the issues that I think are very important. The other one is it might be time. The problem is when you've got an administration in Washington that is intent on playing checkers instead of chess, you've got things like, for example, healthcare portability, allowing Mexicans and Americans, the huge American diaspora community in Mexico that Leslie knows so well, allowing them to use their insurance in Mexico at a fraction of the cost of what it would be to do the same in the United States, and without having to move across the border because they can't get coverage or because they think that healthcare is better on one side of the border than it is on the other. So I think sort of we've got a couple of issues like this. Totalization of Social Security is another piece of paper that's being Leslie is laughing because she remembers that with the Bush administration, we had this ready to roll, and there was a big brouhaha over healthcare before Obamacare, and sort of with the documents signed, the agreements inked, they were put in a drawer, and they're still there, they're still signed. And so these are some of the things that I think we also need to look at the strategic mega trends that will impact us as a region, but there are also very small pieces of the Lego building process and the relationship that we need to look at. For example, again, healthcare insurance portability and the issue of totalization and social security between both countries.
Chris,
Thanks,
can I jump in very quickly?
Yeah, please do, Duncan. Go ahead.
I think that what Arturo just said is really, really important about, how do we define what is essential? And we need to take a pretty broad definition of this, I think, is one of the lessons that we've learned out of this crisis, is that we can't go with a narrow definition of what is essential, because as we repeat over and over again at the Mexico Institute on a daily basis, this is an integrated manufacturing and exporting platform that we have in North America. And so, a little widget that's produced in Querétaro has a huge knock-on impact in terms of the production process in the rest of the region. And so we really need to have a proper review of what we define as being essential. I think the review itself is something that we really need to engage in. And I hope that governments take it seriously. They have done after prior pandemics, and they've looked at the experience. But I have to say that we've heard from government officials during this pandemic that the pandemic hit too quickly. There wasn't enough time to focus on regional responses. Everybody was focusing on the national level. And we've heard it not just in North America, we've heard it around the world. The fact is that we all know that that's simply not true. We know that there was evidence out there. And so we could have expected a better response than the one that we've had from governments all over the world. And I think that, when I spoke to officials in Mexico about the NAPAPI and how it was being used, they said to me, they said, look, we're just using it as a tool of communication. That's very, very important. I don't want to downplay that. That's vital. But communication is only one part of the answer here. And I hope that in the aftermath of this pandemic that we go back and we see how that institutional mechanism can be strengthened. And one of the things that I think needs to go in there, in addition to that question of what is essential, is actually the question of human capital. We think about the supply chain in terms of widgets, components, etc., ventilators. But what about the people who are making those? What about the people that we need to work not just in agriculture here in the United States, in meat processing plants, but skilled workers as well, and in particular, of course, those folks in the medical profession? How do we make sure? How do we prepare better for the future in North America by using all of the immense riches that we have in the region in terms of human capital? How do we focus on training programs, et cetera, to prepare for the next pandemic? And these are things that could be much better done if we approach this on a regional basis rather than on a national basis.
Thanks, Duncan. Just one more question that I want to throw out before we then turn to the audience questions. This is from Ambassador Bassett. You're a former representative of the national government, of the U.S. government, but you're now living along the border. You get to witness some of that subnational, whether it's city to city or state to state cooperation and connections that are going on. Can you talk about how you're seeing that right now? In the context of COVID, I mean, you have this whole experience from H1N1, but what are you seeing in terms of this interplay of, federal conversations, state conversations, local conversations, and what kind of cooperation or disjunctures, are you witnessing right now?
Well, in my professional capacity, a decade ago, I understood the importance and the unique sort of culture that exists along the border that is a little bit distinct from the culture of our respective capitals, and how much that culture is valued by the people who actually live along the border. We had an embassy and 10 consulates. I think 7 of those consulates were along the border, and we did pandemic management on a sort of consulate to local government basis as well as a capital basis. And I think that those structures, those relationships are just as important in some ways as the capital to capital structures. Coming back to the border 10 years after leaving Mexico, because I left in 2009 to go to Asia, actually, what I was struck by immediately was by how much more extensive border infrastructure has become over the last 10 years on both sides. Mexico now has a much more robust border infrastructure on its side, and our border infrastructure is mind-bogglingly ugly, but large and sprawling and growing constantly. And every 2 weeks they're closing down another part of I-5 so they can expand some part of the border. And yet it's still not big enough. The flows of people, the flows of goods, the flows of services cannot be accommodated by the infrastructure that is still there. And of course, that's compounded by the complications of, increasing your gateways, but also building walls and managing a lot of other issues associated with crossing the border legally or illegally. All of those challenges still remain. The dialogue has really not moved forward a whole lot. The infrastructure is bigger, but not big enough. I am in San Diego, which is the host of an idea that was proposed while I was in Mexico in 2009, and I thought never had a chance, which is the Cross-Border Express, an airport that actually crosses the board sort of in Otay Mesa in the San Diego area. You walk into Tijuana and board your plane in Tijuana. It's an extraordinary resource for those who don't want to go to LA, and yet it is underutilized. Anecdotally, a lot of people in my area cross the border for medical care. Because it is more personalized, as you all said. It is also financially more feasible. But what we're seeing with COVID, again, anecdotally based on news reports, is Americans coming back for exactly the reason Andrew raised. Their insurance won't cover the costs in Mexico. And so, when I was there, it was all about, let's get Medicaid to Mexico, and it was not possible to do. And I saw that it was the holy grail, I think, in the paper that Andrew and Duncan wrote. There are still a lot of challenges and a lot of ways to improve, but that fundamental spark of the border being a rich, opportunity for investment, for social collaboration, for cultural exchange hasn't changed. It is still really vibrant and positive. And that's the part that drew me back to it these many years later. Thank you.
Thanks, Leslie. Really appreciate that. So we have a question from the audience that I think is relevant to the conversation, but a part that we've maybe been missing. This is from Steven Zanizer, and I might be mispronouncing his last name. My apologies if I did. But about collaboration of NGOs or non-governmental entities. I mean, we've been talking about subnational, city, state, and national. What, and this could be for anyone up here, but perhaps Dr. Dutton or Leslie or Andrew or Eric, whoever has seen this, what can you tell us about during H1N1 and or during COVID-19, any cooperation at the NGO or civil society level that has been useful or could offer us some sort of suggestions to what we could be doing right now? Go ahead and unmute yourself if you want to.
Can you hear me?
Yes.
Well, I'll just small short comment about NGOs. NGOs have done tremendous work. Most notably for me in watching the issue about migrants coming to the border on the U.S. side and how NGOs stood up and did an amazing job. There's something called the U.S Mexico Border Philanthropy Institute in San Diego. San Diego is very unique in that it has a lot more endowed capacity than many border cities. And there's many examples of NGOs working, but it's a little bit fragmented. Community foundations, philanthropy on the border is very underdeveloped, and I shouldn't say there's not great examples, but I can't pick, in terms of H1N1 and COVID, I can't think of how the NGOs are functioning either side, but there is a developing area with NGOs in Mexico and the United States border region. I just wanted to mention at least the fact that there is things in place.
Thank you. And Ambassador Sarukhan, do you want to jump in on this?
Thank you, Chris. This is an important question and it's going to sound weird for someone who spent 20 plus years in the Mexican Foreign Service in the federal government, but I think it's part of the secret sauce of the success of the relationship going forward, which is the growing importance of actors outside of Washington, D.C. and Mexico City. I do believe that the deeper connections that we can foster between governors on both sides of the border, they don't have to be border governors, but governors on both sides of the border, between mayors on both sides of the border, between NGOs and civil society on both sides of the border. The mantra in the relationship is cooperate bilaterally to solve locally. Each one of these experiences that mayors and governors and NGOs and watchdogs engaging with their counterparts in Mexico, talking about best practices, what works, what doesn't, and then applying some of those solutions on the ground on either side of the Mexico-US border, I think is part of the critical recipe for success and traction, particularly a moment in time when both leaders in Mexico City and the United States are not particularly engaged in the U.S.-Mexico bilateral relationship. So I would underscore that I do see what happens outside of Mexico City and Washington as a key to the future success of the U.S.-Mexico bilateral relationship, and obviously in the arena of public health and human resilience, human security on both sides of the border, written at large, that they are a key player.
Chris, I was going to jump in, Chris, if you don't mind.
Go ahead.
Yeah, and I just circling back to this question about NGOs, fantastic question. We could have gone into that. We had to cut this chapter off someplace. Lots of good work there. I would reach out to Andy Carey at the U.S. Mexico Border Philanthropy Partnership. The BPP has a long-term interest in work with health related organizations in the border region. I would also point out a lot of the work that's been done in the border region on the specific issue of air quality. Air quality in a lot of border communities is terrible, and this is there's several reasons for this. One of which has to do with border crossings themselves and how they are built. We're talking about tens of thousands of cars crossing every day in San Diego at the various ports there, along with diesel trucks. And I think diesel trucks, there are older diesel trucks in those cross-border fleets that are quite polluting, quite honestly. And I mentioned air quality because Dr. Dutton can correct me if I'm wrong, but air quality, poor air quality, has been shown to be a factor in COVID-19, I would say particularly in Chinese communities that have been affected. But just wanted to touch on those two issues. This issue of NGOs is a great one.
Chris, very quickly, if I can, there's some very interesting work that's been done on the question of HIV and AIDS in border communities, and the fact that NGOs have been very active across the border. Some great case studies that have been done in Tijuana, San Diego, for example. A researcher out there, Neelan Barnes, who's at California State University, Long Beach, has done some really good work on this. And it's very interesting to see how those organizations have been organized in a cross-border fashion. And a lot of the funding for health organizations in Tijuana is coming from San Diego. But I think we also have to remember here that, going back to my earlier comments on human capital, we have seen, of course, health workers in U.S. hospitals who live on the other side of the border and have to cross over. And that's a vitally important component to remember at this time. And we've also seen cases of U.S. doctors and medical staff heading south to help out their counterparts in Tijuana hospitals. I think those are very, very important cases. They remind us once again of how the local level is vitally important, and again, that human connection.
Thanks, Duncan. So we have another question. This is from Daniela Chaparro, and it's basically asking, is there a proposal, or what are the plans to keep the border open, or when the border opens, to stop COVID from propagating back and forth across the border? Have any of you heard of any sort of ideas, and beyond, I suppose, I mean, the way I'm thinking about the question is beyond simply reopening the border 100% and without any checks or any special protocols in place and just hoping for the best. Have you heard of ideas, or do you have ideas for how it could be managed, a more controlled reopening, a more careful reopening of people traffic across the border? Of course, commerce continues to flow across the border right now. Movement of what are deemed essential workers continues right now. but people, for shopping, for family visits are limited in their ability to cross the border. So as that starts to reopen, what can be done to ensure that the border can still act as some sort of a membrane, perhaps, to prevent the spread of COVID? Does anyone have any thoughts on that?
I'll jump in, Chris, if you don't mind. At the border, there are 3 crossing environments. One is commercial. That's where the trains and trucks cross. Those are ongoing. Those are deemed at this moment to be essential traffic. The other environment, major environment, is the passenger vehicle environment. And I think that those crossings can be managed by CBP and the government of Mexico as well. I think the one that worries me the most is the pedestrian environment. And some of these pedestrian crossings, I've complained about this many times now, some of these pedestrian crossings, no longer in San Diego, they have very nice crossings in the San Diego region, but some of these pedestrian crossings are like something out of a bad movie or a horror flick. They are, people are just jammed in closely together. I've seen reporting that social distancing is not being enforced in the pedestrian environment. So that is my major concern, and I think that should be the focus as we reopen to non-essential traffic.
That's a great point, Eric. Okay, so we have a question about preparedness, and we've sort of talked about this a little bit here and there, but if we could sort of get an assessment of where we're at in terms of overall preparedness for future emergencies. And obviously we're in the middle of a pandemic right now, but I think this question is sort of looking out forward and sort of saying, given the state of U.S. Mexico relations today, given the state of governance on both sides of the border, given the long history of collaboration that's developed and precedent for collaboration, taking into account all of that, the good and the bad, how do you all assess the state of readiness right now to face something perhaps like COVID-19 or perhaps something different in the future? Let's let's go to Leslie first. Thank you, Ambassador Bassett.
Yeah, I want to comment on kind of an existential change between 2009 and today, which is that sort of first reflex. In the case of Mexico in 2009, the first reflex was to, take care of your people, do the maximum, and share as much information as possible in a world that at that point in time, I think, was still sort of outward looking, and globalization was much more readily embraced than it is in the world that we're in today. And I do think that Mexico's example was an example that prompted others to the same high standard of both transparency and also protection. I think in this world that we're in today, the examples, not just in the United States, but around the world, have been very different. And they have been much more inward looking, protective, close borders, close the optic. And that has repercussions, I think, in terms of cooperation. I mean, if we're pulling out of the World Health Organization, it is not really the model for how to collaborate globally on challenges, whatever they may be they health, be they natural disaster, or other transnational optics. And I do think there is a sort of an existential reality that assumption that global cooperation was a net good, almost no matter what, is an assumption that no longer stands as valid by many governments around the world and many people around the world. And I do think that is a fundamental change over the last 11 years.
Thanks. I mean, one place that I'd point out, just myself, I'll turn to Ambassador Sarukhan in just 1 second, is just looking at the way in which the border, partial closure of the border, was managed. And in that sense, I think there was some institutional momentum for cooperation that allowed that to happen in a way where there was a conversation between Canada and the United States and between Mexico and the United States, so that it was jointly announced, not imposed unilaterally. And frankly, that's impressive given some of the challenges in U.S. Mexico relations these days. And so I think that speaks to the institutional architecture, the bureaucracy and the level of connections across the border that officials have developed over time, and that remain there today, even as circumstances have changed, even as everything that you just mentioned, Ambassador Bassett, has come to pass. So I find that a very interesting sort of way to think about this. But Ambassador Sarukhan, please go ahead.
Thank you, Chris. I wanted to add on to what Leslie has said, which is I fully concur. I think the global political context today is much different from what it was back then, regardless of the different shape and dynamic of this particular pandemic compared to H1N1. But at the same time, I do think it behooves Mexico, the United States, and Canada not to let a crisis go to waste. And precisely because the world seems to be moving to a paradigm of efficient versus efficient governments, regardless of whether you're on the right or on the left. And that may be the critical cleavage point going forward as people start evaluating lessons learned from the COVID pandemic. Because of what's at stake in the relationship between the United States and China, again, there is an opportunity for Mexico, the United States, and Canada, despite the more inward driven focus and paradigm, even in Mexico, particularly in Mexico and in the United States these days, there still is, I think there should be, the day after, when we reach the day after scenario in the coming weeks and months, for the three countries to get their heads out of the sand and understand that they did miss some signals, they did miss some trains that they did not board on time. For example, harmonization of supply chain, of essential sectors, so that supply chains would be disrupted as least possible, and trying to, despite the fact that some in Mexico poo-poo whatever came in previous governments, despite this U.S. administration, which really doesn't seem to like listening to expertise and to what it thinks is the deep state, there are very important lessons and protocols that officials on both sides of the border, of the Mexico-U.S. border, have been doing yeoman's work to prevent the wheels from falling off the cart, despite the challenges that we've had in the last 2.5, 3 years in the relationship. And I think it does behoove the three capitals, precisely because of this more inward-looking trend that we're going to be seeing around the world, to try and deepen the North American footprint and to strengthen the North American edifice.
Thanks, Ambassador. Andrew, Chris, do I see you wanting to jump in?
Yeah, well, I don't disagree with anything that's been said before, but I think maybe on the more positive side, if you look at the collaboration that occurs outside the federal government, it happens inside as well, but if you look at what happens, as has been mentioned, across the borders between the states and the cities and the private sector, I think there's still room for some optimism that, sort of, despite what happens in the capitals, those of us who pretend for a moment I'm not in the DC area, that the rest of the citizens of North America will continue to collaborate and work together. There's an initiative that AdvaMed and Google put together, essentially a clearinghouse where people can find out where PPE and inputs for devices and things can be found, and sharing information so that to address some of the supply chain challenges, et cetera. So I'm always struck by how much happens, sort of, despite either inaction or even, if you will, negative action on the parts of the federal governments at senior levels. And I think a lot of that will continue just as it has.
Thanks, Andrew. I'm going to stay with you for 1 second. I have a question that's specifically guided towards you. Patrice Franco from Colby College asks if you could expand on any of the challenges and opportunities of cross-border telemedicine. And then to close, I'm going to just turn it back to everyone. We had another question from the audience, about being, sort of, concisely identifying a best practice that you take out of the H1N1 experience that you would put forward, something you would put forward as a best practice based on that experience. So, Andrew, if you want to start, and then we'll just go around as a way to close this panel.
Sure, happy to do that. I think one of the opportunities in telemedicine is, if you think about bilingual patients or even predominantly Spanish-speaking patients in the U.S. If there were a system, and there are companies, in fact, offering this, where you have a doctor or a nurse based in Mexico or some other Spanish-speaking country that essentially does the telemedicine consults so that the person is speaking in their native language, that can be, it is both cost-effective and a lot more comforting sometimes to the patients. So that's one opportunity. And another, as I mentioned, the model of having consults from, let's say, Mayo Clinic to a small hospital in northern Minnesota. You could do the same thing with consults to clinics and medical facilities in Mexico. And again, given the number of bilingual practitioners in both countries, finding somebody who could either speak Spanish from here to a Mexican doctor or speak English to a doctor in Mexico who also speaks English, it's really not, I think, it's not an impossible situation to construct. And it really could allow for, frankly, a lot more access to healthcare in Mexico at a lower cost, and also reduce costs here.
Great, thanks. So we'll just do sort of the lightning round, running through everybody for a final comment, or particularly a best practice that you take from H1N1 that you'd put forward going forward. Dr. Dutton, do you want to start with that?
Sure. So that I figure out, am I on?
You're on.
Okay, thank you. I guess I take the opportunity to emphasize something that Mr. Rudman and that paper that him and I think Duncan have worked on. NAPAPI, I still believe it's an important framework. It's very broad. There's a lot more than just the border involved in it, but all the bilateral considerations. Those frameworks do need to be, if you will, propped up and revisited. I wanted to mention that CDC on their website has a agreement that was signed between the United States and Mexico, between the Secretaries of Health in Geneva. And it's really a document that talks about cooperation for public health events of mutual concern between U.S. and Mexico. Provides a lot of detail on the public health side about how you should coordinate and communicate. These are guidelines that need to be implemented and executed so that we are prepared for a pandemic, but as well for ongoing disease surveillance. They're been left really to the locals and states to try to implement, and I really think that we need the federal government, including, for example, the U.S. Mexico Border Health Commission, which has not been functioning at the level it was. I think Andrew pointed out that institutions were really going well for a period of time, and the commission came into place in the year 2000 and is still in place, but other institutions as well. So I do believe the federal frameworks are very important for us to get the work done at the state and local level. Thank you.
Thank you. Eric, do you have a final comment?
Right, I think it's been touched on, but I really think that we need to work hard to strengthen institutions. The other thing that we have coming online here within a month is the USMCA. We haven't mentioned that yet. Healthcare is not a part of the USMCA. I'm not sure why this is. Hopefully Andrew Rudman can enlighten me sometime after the call. But can we use the energy of the USMCA to somehow strengthen our healthcare collaboration? I'm not exactly sure what that looks like. The other key institution, Chris, that's missing in action here is the U.S. Mexico Border Governors Conference. We've talked about this a lot. The role of governors in addressing this particular pandemic has been critically important. That's an institution that I would look at reviving, strengthening, funding, and staffing.
Thanks. Ambassador Bassett.
So I'm going to cheat and go back to my first pandemic, which was actually working on HIV/AIDS in Botswana. And what I think is really important is the public-private partnerships and the global response. And I'm going to say those are the takeaways that we should apply in almost any pandemic situation. Thanks.
Thank you very much. Ambassador Sarukhan, any final comments?
I think the biggest lesson is that in this relationship, if you don't have a whole of government approach, a holistic approach problem solving, to collaboration, to communication, to engaging with local and state officials and civil society, things tend to not work as they should. And so when we think of this or any other issue in the U.S. Mexico relationship, we have to understand that unless we use that full machinery that this relationship has developed and built over the years, we won't move the needle in ways that I think we want to for the success and well-being of our two nations. And simply end with one of my mantras in this relationship, which is we have a very stark choice. We can be accomplices to failure, or we can succeed together. We can be partners to success. And I think that what 2009 showed, not only government bureaucracies and institutions, but our peoples, is that by working together, the United States and Mexico can deliver the goods, and that we are stronger together.
Thank you. Duncan, do you have a last word you want to put in before I close things? Good.
Everybody, it was a fantastic conversation. And in terms of Eric's comment about USMCA, I think there are opportunities there, Eric, in terms of procurement, and I think in terms of health regulation. I think that there is a space that we can open up because we've overcome the challenge of renegotiating NAFTA, that we can now move to look at health regulation in a coordinated way in North America. I think the pandemic has proven that that's vitally important, particularly in terms of the speed of getting medicines to market, medicines to patients. You know, in the past year and a half, Mexico has approved only one new medication through COFEPRIS. That is unacceptable when we're in a time of a pandemic. We need to be able to move in an agile fashion. And what better way to do that than to come up with some kind of agreement between the regulatory agencies in North America on public health?
Well, I'd just like to thank all of our panelists for joining today. This has been a fantastic and interesting conversation. I want to encourage everyone who joined today to take a look at the papers that we're referencing on the Mexico Institute website. And thank you all for joining us today. We're continuing to do work on both COVID and the numerous other issues going on in U.S.-Mexico relations coming down the pike, including the implementation of USMCA. Thanks again, and have a good afternoon, everyone.